If you click on this video, that means there is something that interested you in this video about hair loss. Thank you and welcome. I'm Dr. Shevanta Daniel. I'm a family doctor and aesthetic doctor. Today I'll be sharing my experience in this video about what we see in the practice, what we wish our clients would do, what we wish our clients would take action about before it's too late, because in family medicine, we pay a lot of attention in preventing of heart disease, cancer, diabetes, if it's going to be something along with breathing issues, infectious diseases. So there's a lot of prevention we can, because as you know, prevention is better than cure. Not that cure is not bad, so that's what it is. So as a family doctor, first and foremost, I see a lot of hair loss. In my life, I had delivered many babies, including when I was going through my residency in Ottawa. I had delivered many babies, and guess what? Most of the babies are born with very little hair, right? Very little, but I had seen some who are really, really great hair. And there's a funny story I'm going to tell you after some time, and I believe there it made some role, okay? And if my client is watching that, and she definitely will agree with it. And also, I treat people all throughout their life. So we see clients when they were born and during their teenage, and when the acceleration, the hormones come in. In some people, it doesn't come in, and then they go through, adaptation into normal human life and go through the stressors, go through medical conditions, job losses, relationships, giving birth, multiplying, going towards, and then they will go through a different stage of life where their kids are growing, and then the kids are going to bring something else, which is happiness as well as some challenging moments. I see what happens with the hair and the emotional status, and then we go towards the end part of life. In males, you can see a lot of hair has been gone, whereas in females, some areas the hair will be actually growing, versus the males, the hair loss, right? Predominantly. So you can see that I see quite a bit of variety, but the most interesting thing for us in family medicine, and being in the practice now for close to 3 decades, I can tell you that I admire my preceptors when they mention that we have the privilege of being in someone's life over time. And that makes a huge sense. It's one thing that I meet you for one day and I see you and I say, okay, give this and then gone. I look at what's happening and I give you treatment. Not that I don't want to know what's happening in your life, but as you know, human body is a very complex and efficient machine. Very complex, right? The headache that I have is not equal to someone else's headache. Someone else's hair loss is not equal to my hair loss, for example. So being a family doctor, first and foremost, as my foundation of being a physician in the medical field, I've seen many clients where hair loss happens at different stages of life. And I look at the client in the perspective of their surrounding, because as you know, we are not living in individual bubbles, right? During the COVID time, we know we could not go out, we could not socialize, how bad we felt. And we could see the spike of some of those conditions, especially like autoimmune disorders, cancers. It spiked. One of the reasons is obviously the preventative measures were not taking place because of we were distancing ourselves, as well as a spike of the stress. So when you can see a client in a holistic manner, whether it's going to be their internal medical structure, whether it's a hormonal condition, lifestyle patterns, whether it's going to be stressful situations, financial, social, who they're with, and what substances going through their system, whether it's medication or otherwise. When you look into everything, and not in one occasion, but as a continuum, throughout their lifespan, we get to see clients, and then we will identify, sometimes way before the client, some of the changes that does not catch their eye. And that's the whole principle about family medicine. So being an aesthetic doctor, I could offer a lot more, and obviously so your healthcare providers. And the whole purpose of this video is to intrigue you to consider if anything what I'm telling is in your life. And if that's the case, get into your healthcare provider, whoever it may be. I would suggest a process. That's one of the processes. It's not the only process of managing hair loss. Consider going further and taking action. Because I'll tell you the most funny thing. There are some clients who I would say, listen, I can see there's a little bit of a change. Most of my clients, I've been knowing them for 16, 18 years and even more. I tell them, listen, I see there are some changes, or sometimes they themselves will come and say, I saw some hair. We pick up from there. We start talking, explore options, everything that I have mentioned about. Then I would suggest you may want to act up and do A, B, C, D. But it's manageable, nothing much, and then they will just, yeah, I'll come back, and some of them will Google, get some other information. I'm not against it, to be honest with you, because there's a lot better, more information out there for us to explore. And let's be honest, any information is good information because that gives us a contrast to see true or not true and explore and then educate ourselves. And when they come to us, we're more than happy. We can tell what we know in our field and they can make a conscious decision, okay? So an informed decision. So when I tell them, you may want to consider some action, and when they leave it, I see them after some time. Obviously, we see quite a bit of clientele. And when they come in, I can already see it's not only the hair, but now the person had lost their confidence, self-esteem. And now it becomes a very complex vicious cycle. What am I trying to tell you? When we see we are based on to react, right? As humans, we want to see a result and we react to it, positive or negatively. Unfortunately, our human mind is trained more towards negative, and there's in psychology about the negative bias, if you know about that. Our human mind, for some reason, get attached and attracted to the negativity. That's where all our situations, I believe, most of the core foundation of our medical conditions are starting. So, when the client comes and says, oh my God, my hair is lost, and I would spend anything to fix it, that becomes a little bit of a challenge by itself. The reason behind is these conditions, as you know, hair cycle has different cycles, right? Anagen, telogen, catagen, and exogen. So the growth phase, the resting phase, the shedding phase, as well as the transitional phase. So when someone had gone through a chronic stress, and whenever we talk about things, we know the most powerful thing is stress, but what is the measure for stress, right? Someone's job loss is not someone else's job loss, how they would take it. It's not how their body would react to it. But nevertheless, some people have like a boom trigger, which is a divorce, death, whether they have a job loss, a change of a country, gone through a severe illness, whether it's going to be HIV, tuberculosis, whether it's going to be a severe COVID form, or multiple, or any surgery, or childbirth. Everyone's stress is very different. But what people always get confused when we talk about stressors, and I sit and I think about how I can actually understand this. We talk about stress, but how actually is the stress? We have some things called acute stressors, like boom, you get that, and then, for example, someone's dead, right? It's acute stress, boom. And we know that we react to it. Our system reacts to it. Cortisol, adrenaline, noradrenaline, thyroid hormone, everything will react to it because either we go to a fight or flight or acceptance phase. With all those things, our hormonal panel changes, blood circulation changes. It'll be sending blood to the vital organs for us to sustain life because now we go to the survival mode. So there's a response to it. So what it means is hair becomes secondary. But imagine that someone is living through this for many weeks, months, and decades in a chronic stressful period. And that's how our lives are, most of ours. We're always thinking about, and we don't think about, but if I'm going to break it down, you may agree. If you don't agree, I respect your wish. We have ongoing stressors, but not only one. Whether it's going to be, am I going to have my job for a long period of time? If I don't have my job, I cannot pay my bills. I cannot pay the phone bill. I cannot feed my children. I cannot pay the mortgage. I cannot pay the car loan. Is this job going to last? Or is AI going to take over my job? Is the gas price going to be higher tomorrow, or can I manage with my salary? Am I going to have kids, or am I infertile? If I have kids, how are they going to grow? Which society they're going to grow? What are their values and idealization going to be? And will I get this disease, that disease, this disease? Okay. There's a lot of talk about prevention, so should I start to make sure that it's not going to happen to me, right? Then we look at the climate change. Then we look at the medical conditions, the finances. So imagine everything you put 5%, for example. Don't add up and see how much of 5% will come in your life. And then or I'm changing. I don't have the energy that I used to have. My hair is changing. Oh, people, my children are leaving. First, I was worried about having kids. Now the kids are grown. I don't know with whom they're going to go. I don't know whether someone is going to bump on their face. They're going to fall. And what if they don't get into school? What if they don't get a good job? What if they don't get a good partner? Oh my God. So all my efforts are going to be in vain. I'm again talking about, this is a very broad topic. Some cultures do, some cultures don't. But even you look at the animal world, you can see how the birds feed their newborns, right? In the animal world, there is a caring time. So as humans, we do that in a much more complex manner. So everything what we had taken for granted, including driving, is a stress for our body. Climate change is a stress for our body. So when we are going through chronic stresses, which have become a normal in life, we are always unconsciously or subconsciously in this majority of the time in the survival mode versus the resting mode. So what that means is our sympathetic and parasympathetic nervous system, the sympathetic nervous system is always active. We are worried about, will this happen? Will that happen? Will that happen? Will that happen? So when there's a high level of adrenaline, noradrenaline, and cortisol, what will it do for our blood vessels? Obviously, we know about the metabolism related to cortisol, what it can lead to. So when we are in a kind of a hyper-metabolic state, our thyroid hormone will increase. We will have adrenaline, noradrenaline pump in the heart. Blood vessels get shrunk because the blood supply need to go to the places where it's needed, to the heart and the brain and the kidneys for us to survive and function and take good decisions. What does that mean? Everything else becomes secondary. Whether it's the skin texture, whether it's going to be the hair texture, whether it's how our skin is going to age and rejuvenate, and everything becomes secondary. Because for me, I need to make sure I live another day with, if I cannot go better, at least my same status. How many people come to me with job losses? How many people come with marital difficulties? So as a family physician, I consider being a very privileged position because I can see not only the individual, but how the surrounding environment reflects on the individual. So if someone comes with hair loss, we spend quite a bit of time exploring what's their surrounding, where they're going to live, because I can give you X, Y, Z and send you back. If you cannot afford it, if you don't have peace of mind to do it, or if the emotions are not there for you to do it, if you don't have a stamina and motivation, what does it mean of having a diagnosis, a label, and a treatment if it's not within your belief system? And as you know, belief can change things. If you negatively believe, unfortunately, we attract the negative results. Which we fear, unfortunately, we attract it. If you positively think about it, we're actually going to multiply, we're going to grow. So the whole purpose of me talking about what my experience in our practices and what I would suggest you all to consider is to also have a mindset, because treating alone a medical condition, mind you, hair loss, highly likely is just a symptom. Whereas the foundation cause, I'm much more interested in looking at the foundation. And obviously so, that's the reason you are tuning into this video. So there are many types of hair loss, as you can see, right? Males have male pattern, then there's a female pattern, then they'll call as being cicatricial or non-cicatricial, which means a scarring alopecia or non-scarring alopecia, where there's going to be as a result of, and you see the word, right? Result of, which means something happened, hair loss is a result of, right? If it's going to be a result of infection, like, let's make it, there was eczema on the scalp, there are psoriasis on the scalp, then became a bacterial infection, got cellulitis of the scalp or folliculitis, now it started to be scarring, and then that leads into what we call the cicatricial alopecia or scarring alopecia. So what was the cause? It was infection, right? And if you're going to look into a thyroid condition, we will say hair loss due to hyperthyroidism, for example. When thyroid gland is overfunctioning, it reduces the thyroid stimulating hormone in abundance, and what actually it will lead is in the blood, it goes the opposite. It becomes toxic, and the hair cycle alters as a result of it. Another condition is diabetes. Diabetes, we know that the high sugar levels by itself is toxic, what we call hyperglycemia. And then we have hypoglycemia, not much of oxygen, not much of the energy going, and the hair cycle cannot much survive. Or it will accelerate the growth of the cholesterol, atherosclerosis, blood vessels get blocked, blood doesn't go, nutrition doesn't go, oxygen doesn't go, hair doesn't survive. Hair loss. But the cause was diabetes related, what we call micro and macro angiopathy or vasculopathy or blood vessel disease, right? So if you are going to be looking at hair loss, always my suggestion will be to look into the cause. Sometimes our immune system stands against us. We go through viruses, we go through the stress, and our immune system, which is meant to protect us, will recognize some of our own cells, and highly likely as a result of a small mutation, right? So imagine my hair has a unique identity that my T cells and M cells in my immune system will recognize and say, I don't need to kill this. This belongs to me. Okay, fine. But imagine I went through climatic change. I went through a bacterial infection. I went through a huge stress. And that altered some part of the hair cycle. So when the immune cell look at it, the hair bubble, which should be like this, looks like that. It says, that's not mine. Okay, start attacking and killing it. That's what happens in alopecia areata, right? We know that in selected areas, hair is being lost. All the hair follicle had gone into dormant stage. The hair loses most of them overnight or within 2 nights. And as a result of immune system attacking its own cells. It happens in arthritis, especially in osteoarthritis. It can happen in rheumatoid arthritis, psoriasis and other autoimmune. There are Goodpasture syndrome where the kidneys get affected. There are many conditions where our own immune system, for some reason, get confused and start to be attacking. It could be as a result of infection, viral attacks, mutations, you name it. Okay. Again, hair loss as a result of, right? So always hair loss, majority of the time, is a symptom of a bigger underlying cause. So if you don't attack the symptom, and if you are doing on only some topical treatments, you may want to consider twice. It may work. It may work as long as you do it. It may not work, or it may give mixed results because some of the things like alopecia areata or Telogen Effluvium, over time, sometimes it can get resolved by itself. So that's something that I would invite you all to do. So when we look at all these conditions, right? So imagine I'm combing. There was one client who came in, and I said, we are doing everything. And then at one point I said, you know what, how do you comb your hair? Oh, I just comb very mild, because we talked about it in the beginning. And then I said, if you don't mind, bring your combing devices. And then I came in, and the way that I saw the person had long hair, the combing, for me, it was like really choking, like it was so strong. And that was normal for that person. So imagine how it was prior, right? So if that's the case, what we consider as being normal is not normal for someone else. So sometimes as healthcare providers, it's nice for us to see how this person is actually doing things when they're not in front of us. I ask them to bring their inhaler. I see what the technique of the inhaler, how they're injecting their insulin or Ozempic, something else, or how they're using the blood pressure machine, right? So these are small things but make a huge difference, because you'll come to us for a couple of minutes, your life is out of our offices, and that's where, if that something is not happening properly, unfortunately, we don't get the benefit. So there's something called the cicatricial or the scouring alopecia, right? Traction alopecia, when you're like combing hard. Some psychiatric conditions. I see quite a bit of clients with mental health conditions, right? Anxiety, depression, bipolar, whether it's going to be obsessive compulsive disorder or paranoia, delusions, everything, right, in our life. So when a client comes in, and some of us, when we are like so frustrated, we are the clench our teeth, bite our teeth, or there's a pull on the hair, right? Imagine some people, it's their coping mechanism. Every time I have clients who are doing this, they don't realize it. I see them in the office, and I say to them, does this go? No, I don't touch my hair. I don't know. But the thing is, while the client is seated here, when I talk about some of those very concerning results and abnormal abscess, cancer cells are coming in and anything else, the person is already pulling the hair, but the person doesn't recognize it. So having spent some time with your client and then looking into some things that they don't realize is very, very important. So these are some of the advantages of being in our field that we have, because we can see them multiple times. I can see you all in good days, bad days. I see you through a lifetime of changes, good and bad, and how it affects on your internal as well as external health, right? So metabolic causes like thyroid, whether it's diabetes, adrenal causes, anything can actually affect on the hormonal panel and affect on the hair cycle, especially with polycystic ovarian disease, where there's a gynecometabolic condition in females, where there can be weight gain, there's acne, male hair pattern hair growth, sometimes what we call as a hirsutism or even virilism, like male pattern changes in the body. And with that, the testosterone levels go up because of the aromatization in the fat cells. and it'll start to be attacking on the DHT sensitive hair, which is predominantly where the androgenic or androgenetic hair pattern is in ourselves. But the other areas, it's actually going to grow. But this area, unfortunately, that's where the hair loss. So when females see more hairs coming onto the comb, more in the shower, more in the pillow, get in touch with your healthcare provider, start the process. I would recommend you all to go with a blood test first. You can look into the thyroid, kidney functions, magnesium, calcium, iron. You can look into the liver function. Some of the liver conditions can actually cause, and also to see an ESR to see whether there's inflammatory conditions. Obviously, there's ANA, double-stranded DNA, and pretty fancy stuff like the Sjogren's disease or dermatomyositis, where you get the anti-LA and anti-LO, anti-JO. So those are like fancy stuff, but you want to really start with the bottom of the problem. Polycystic, FSH, LH, prolactin, testosterone levels, and also the clinical findings, and if you want to have an ultrasound. So obviously you want to see what is this a reflection of what's happening inside? Is this a symptom, or this is itself the condition is here? So once you have that delineation, you can go on to the next levels, whether it's going to be metabolic, like what we talked about, whether it's going to be something related to thyroid diabetes, whether it's going to be something like infectious, whether it's folliculitis, whether there's a secondary infection, treat it, because it'll lead to the secondary healing, which is scar formation, and scar is just obstructing the hair follicle to grow, and unfortunately we produce scarring. That itself, we will have to dissolve the scar, so sometimes there are some of those Rogaine products where it has the alpha hydroxy acid to actually do a kind of a micro peel there, or we can do micro needling where I do in my aesthetic practice. But again, those are fancy stuff. First thing is to start first, right? And also think about the attraction stuff that we talked about, how you braid your hair. Some of the ethnicities will have extensions, how you pull your hair, how the hairdresser is doing your hair, and change of the chemistry of the hair. Too much of bathing, unfortunately, change your pH. It needs to be a little bit of acidic pH. If you're too much doing cleansing, cleaning, conditioning, shampooing, think twice, because we have a natural defense system built in our skin, that is our skin pH. If we wash it too much, if we put fragrances too much, if we do shampooing too much, if we do ironing too much, or dyeing too much, it can actually affect on the hair environment. So consider again any conditions like seborrheic dermatitis, like the dandruff, if not the scalp psoriasis, where the scalp area had been inflamed. It has autoimmune component as well as a local immunocomplex mediated component that can be very toxic to the hair, and as well as other conditions like androgenetic, what we talk about, traction stuff, and the rest goes on, and alopecia areata, where the immune system. So it's a very interesting world. But then again, looking at a symptom, finding the foundation, and we look at the triggers. It's just like, I'm going to get a plant, I'm going to get a seed, go and put the seed in the most fertile soil. If I don't water it, the seed doesn't grow. If there's no sunlight, seed is not going to grow. If I don't put fertilizer, not much of results. If I over fertilize, that's going to be another condition, right? It's going to be toxic. As well as, imagine there's going to be a gasoline leak. The plant was coming up, no, it's going to be toxic. Or I'm going to be every day cleaning around the plant and making sure that nothing happens. I'm disturbing the environment. And imagine I'm not going to allow that plant to have enough space to grow. I'm going to be putting many plants around the area. It cannot stretch itself. So the same thing happens with hair, because I create stresses around the plant or the seed for it to grow. Same thing happens when we are thinking about a hair follicle. Also remember, chronic stresses, we don't realize it. I treat quite a bit of clients with headaches, muscle tensions, jaw clenching. They'll come with headache. They'll come with some, it's tight for me. And when we go in, shoulder pain, neck pain, and when we go to the bottom of the problem, ongoing stresses, right? If you don't address it, if I keep on giving muscle relaxant, anti-inflammatory, it's just putting band-aids. So when we go through stresses, one thing is the cortisol pathway, and it'll lead into the inflammation with the interleukins and the rest of it, and then accelerate the cholesterol and the plaque formation, and it limit the blood supply. But also there's a mechanical factor where there's the muscles are contracting, our frontalis muscle, our posterior muscle, corrugator muscle, temporalis muscle, occipital muscle, everything contracts. And interestingly, the blood supply goes through the muscles. So if I'm chronically being tense, this blood supply cannot grow. What actually happens is, over time, we have the testosterone effect in males and females. We both have, males more. So we have more toxicity of the testosterone and less blood supply. Think about what's going to happen, right? That's like I don't put water into my plant, but I'm putting, just keep on doing fertilizer. That's what's needed, right? It's going to die. Same thing if I'm going to be considered a female. Menopause comes in, the testosterone level, what they had, is going to be comparatively higher than the female hormones, and now they're going to have the same effect. You would see elderly population with balding, frontal balding, and male pattern balding, females. The reason behind is that, right? Or there could be some things like germinal tumors where there's cancers growing in some other parts of the reproductive organ system, right? So it's a very interesting topic. Or it could be nutritional deficiencies. It could be iron deficiency. Someone is bleeding a lot, whether it's through their genitals, whether it's through their reproductive system, or whether it's going to be through their alimentary or the rectum or anus, or they are not having enough of the iron substance of B12, whether it's going to be vitamin D, huge. And in a complex, when we look at the picture, all these things are needed. And when we address only one concern, that's where we get mixed results. So we can actually enhance the testosterone toxicity by giving DHT blockers like finasteride, dutasteride. And there is also, we can have the topical minoxidil, which comes in a brand called Rogaine. There are other products. Usually the 5% is what we would recommend. Start to be increasing the hair growth cycle as well as the blood supply. And also we have, for females, we would use androgen blockers like spironolactone. We use it as a water pill or a diuretic, but we use it in certain clientele. If it's going to be polycystic ovarian related, then we will address the concern of where the testosterone has been produced, right? Whether it's going to be weight, whether it's going to be diet and lifestyle, whether it's going to be regulating the cycle to have the FSH-LH balance back again. So many, many interesting things. And we can find a solution. If it's going to be diabetes, if it's going to be cholesterol-related blood vessel blockage. So look into the cause and then address the cause. That will be the foundation. And then invest on it. Because when the people start to becoming with stress, oh my God, my hair is lost, I'll give you anything, please get me the hair. Why I mention it doesn't happen like that is the more the person pay attention to the negativity and I say, I don't have it, the more the chronic stress goes up, the more the toxicity remains longer, the more hair cycle will go into the shedding phase. And people have gone through difficulties in life. They know that when you're in a bad mood, when you're in a sad mood, when you're in difficulties, if someone says, yo, pack up yourself and go and work, there's multiple opportunities. It's a free country, go and work. How many of the people, boom, get up and go and work, right? It doesn't happen that way, right? There should be a certain motivation. The same way our brain has to believe in, has to be seeing results for us to believe, which is not the best way to do it, but that's how it works so far. So if you're to do it, I would say cultivate the positivity, take action first. If you're especially someone who's trained with a result-oriented brain, I want to see that so that I know I'm doing the correct thing, do it. But if you're someone who believes it's going to happen, and I will continue with what I'm doing, if you're mentally strong, being adapted to have that kind of a behavior pattern, that works, go for it. But take action early. That's my message for you. And then when it comes to that's the pharmacological methods, and then we will use the sometimes we would use birth control pills in females. In males, we would use either oral forms, what we are using for dutasteride and finasteride for the 5-HT blockers, DHT blockers. So there are many ways, but again, it's a customization. And if it means there is scarring, there's alopecia areata, the immune system is the cause, let's treat it. We will give either it's a topical cortisol to bring the immune system down. If not, I'll inject them with Kenalog or triamcinolone, that's also steroid, to bring the immune system down. But then again, we bring it down, here it goes, but we did not address the cause. If there's a possibility to address the cause, go for it, right? And then again, if it's going to be scarring, microneedling, some other things. And nowadays, the reason one of the things I actually incorporate aesthetic practice into my family practices, I can serve my clients better, head to toe, internal, external, and as a whole person. So quite a bit of clients who I go through with my PRP treatments. As you know, it's your blood. We get the growth factors, which are circulating in your blood. We concentrate them with the centrifuge, inject it into the areas of concern. It has a massive potential to grow new blood vessels, rejuvenate the hair follicle, grow the hair follicles, awaken them from dormant stage, and give you a sustainable result. and no side effects except tiny bit of pain on and off. The reason behind is it's your own product, right? And that's one of the best things that I would suggest my clients to consider. Think about PRP therapy in applicable of clients. When there's no contraindication, go for it. If there's an infection, scalp psoriasis, inflammation, if there's dermatitis, there's atopic dermatitis, whether there's going to be chronic eczema, treat that cause. Seborrheic dermatitis, treat the cause, because without that, any of your treatments, unfortunately, will be helping the fungus to get much more deeper without needling. If it's going to be something along with the help of exosomes, that's messenger cells, where when we combine with PRP, it has their own pathways, gives you phenomenal results. And we also know about the low-level LED, the hair caps and all. They stimulate the hair as well as in the face, stimulate the hair growth. So a combination pathway together with diet, lifestyle, taking away substances. If someone is smoking, for example, of any sort, we know that the nicotine and its effect clogs the blood vessels. It also will keep you in that high tonus, like people feel energized, but with it comes adrenaline and noradrenaline. Consider that, attack that. If there is someone who's in a metabolic state, there are some disbalances, diabetes, thyroid, suprarenal gland, anything, correct it. Liver functions, correct it. So when you look at having an internal harmony and emotional harmony, I'm a strong believer, seeing that in the results in our practice, it's going to pay off, right? So when you're going in, have a mindset that this is a marathon. Even you have a hair transplant, or you're going to consider a hair transplant, do a PRP first. Platelet-rich plasma, get the growth factors, get new blood vessels being grown, make the canalization system for it to have blood vessels, get the nutrition, fertile ground, and then go for the PRP, and afterwards continue, right? People always ask me, do I have to live on this? Well, I would ask you, if you're someone who's driving, you know that you have to change your engine oil after a certain time. If you're having a house, you have to maintain the roof, you have to maintain the walls. If you have shoes you cannot wear forever, it's going to wear off, you have to change it. So everything in our body and in our surrounding has to be maintained. We don't pay much attention because we take it for granted. But if you take attention, if you start to be investing on way early, we can not only slow down the process, but again, we can actually rejuvenate it. I do that with my collagen treatment for my clients, with wrinkle reductions, with the hair, with the reproductive system in males and females. I'm not doing it for them to only feel good. It is also medicine, because we are preventing, restoring a normal body function. And that gives something that I find we cannot achieve through medications. I treat quite a bit of people with anxiety, depression, mental health issues. They are scoring questionnaires phenomenal. There are medications optimized, they're doing, but there's something still missing. There's something of emptiness. And until you address that, that client is, in my opinion, is not fully medically cured, right? Mental, spiritual, emotional well-being, right? As well as the physical well-being. Everything has to be harmonized. So think about helping your clients. And if you're a client, after seeing this video, think about if this touches your life. These are some of the suggestions I make. I had done that in my practice. I do that in my practice. And all the posters around here are there to actually help my clients to consider, awaken a thought process, and then consider. Because as I mentioned, when the hair cycle fully sets in, just like when the fall comes in, when the leaves are falling, okay, we would say, oh, okay, the season is changing, it's cold, it doesn't have sunlight, it's gloomy, blah, blah, blah. Okay, fine, I challenge you. We're gonna, boom, change the climate, give enough sunlight, give the warmth. You think the leaves are gonna go back again right away? No, unfortunately, it has its own cycle, right? Same with the hair. So act early, and there are some of the videos that you will see in my channel about, all about making awareness, let's put it that way. Oh my God, I'm not gonna edit these videos. I like to be authentic. I like to be just the way that I am. Arising. Okay, bring awareness. That's it. Okay, so have information. Come talk to a healthcare provider. It's gonna be so much of fun. And always believe in yourself. I always tell my clients, believe in yourself. Believe in yourself, that's going to happen. Don't believe what you see, but also believe in yourself, that's going to come. Then it'll come. Most of us are just result oriented. I don't see it, I don't believe it, right? Unfortunately, we don't see any hair growth, and we don't want to believe it, and that's what you're going to get, right? So share the love. We all come to our lives for a reason. Share the love, share the passion, appreciate everyone else on earth, and then let's make it a better place for us to live, and let's live happily, right? We're here for you, and thank you for helping us to be in this stage. I'm Dr. Daniel from Dr. Aesthetics. If you think this content intrigued you, if you think that this is something that may be beneficial for someone else, give a like, give a thumbs up, and share this video so that more people will have the insight or the interest that it created in you. And I'll be eternally grateful. And all good comes, what goes around comes around. And let's share happiness, love, and let's serve one another. Have a good day. Take care.